Good morning. Welcome to the OstomyLife, a Shield Healthcare Community webinar with Laura Cox. My name is Eric Yen. I'm the Director of Marketing here at Shield. I appreciate everyone attending. Participants will be in a listen-only mode. If you have a question for Laura Cox, please type it in the chat box on your lower right-hand corner. At this time, I'd like to present Laura Cox, Ostomy Lifestyle Specialist. Laura Cox, you're up.
Thank you. Welcome, and thank you for joining us for our second Ostomy Life webinar. I just really quickly want to say that if you did miss our first webinar or you have to leave halfway through this webinar, they will be available on our Shield HealthCare website, which will be linked on the last page of this presentation. If you're interested, our first webinar's topics were how to travel with an ostomy, how to tell a loved one about your ostomy, and also how to swim with an ostomy. Today's webinar's topics are how to handle and prevent leaks, skincare around the stoma and other daily maintenance tips, diet and nutrition tips for new ostomates. So I really quickly want to introduce myself so you know who you're listening to for the next 30 minutes. My name is Laura, and I am the Ostomy Lifestyle Specialist here at Shield HealthCare. I was diagnosed with ulcerative colitis in 2010, went through all of the medications that were approved for treating ulcerative colitis at the time, including Imuran, Remicade, and prednisone. In 2011, we realized that nothing was going to work, so I went in for a total colectomy and a diverting ileostomy. So about 10 days before I went in for stoma surgery, I looked online for information like intimacy with an ostomy, what you could eat, if you could swim, if I could still run, and I couldn't really find any of the information that I wanted to. So 10 days before surgery, I started a YouTube channel called Ostomy Story, and I basically documented 2 years of experience and what I learned and sharing it with my subscribers. 2 years after I founded that YouTube channel, Comedy Central's Tosh.0 brought me on and I did a little segment. And the CEO of Shield saw that and decided to bring me on board about a year and a half ago. So my job as the Ostomy Lifestyle Specialist is really to infuse Shield into the community and make sure that people know that we are more than just a distributor who sends out supplies and bills insurance. We do that very well, but we also are a resource for our referral sources, our end users, and also our own employees. So now that I've told you a little bit about myself, let's get into the bulk of the webinar. So the first topic is how to prevent leaks. And this title may be a little misleading because leaks are a common problem that most ostomates will experience at once, if not more. There are some preventable leaks, but our goal is really to minimize the number of leaks. One of the most important ways to minimize the number of leaks is to have a good seal. So we're going to really quickly breeze over some products that can assist in creating a good seal. So first of all, finding the correct pouching system is very, very important. I had a bunch of leaks the first 3 months of having my ostomy, and I finally realized that I should go to my WOCN. She was very helpful and put me in a convex wafer, and it has been wonderful since. So direct your patients to a WOCN or a physician that can help find them the correct pouching system. Next, it's really important to have or cut an accurate sized hole in the wafer for the stoma. If the hole is too large, stool or urine can creep underneath the wafer in between the stoma and the wafer, get on the skin, irritate the skin, and cause a leak. Also, don't cut it too small, because that can actually freeze up on the stoma and cause a blockage and also some pain. So you want to make sure that it's just the right size. If you're unsure about the correct size, there are templates that are available, and actually we'll be having a template come out in our ostomy catalog very shortly. Also, use stoma strips, rings, or paste around the stoma. So if you're nervous about having or cutting the correct size hole in your wafer for your stoma, this can actually really help. If you cut the hole a little too large for the stoma, putting stoma strips, rings, or paste around it can keep the stool or urine inside the pouch and not on the skin. It's also important to just change the whole pouching system regularly. So experts say about every 3 to 4 days. If you have an extended wear barrier, it's actually sometimes easier to go 5 to 6 days. It all depends on the patient's skin quality, skin chemistry, and how good their seal is. And lastly, this is my favorite tip. Instruct your patients to hold their hands over their newly applied pouching system. This warms the system out so that to stick really well to the skin. So actually you can tell them to use a heating pad on low, or they can use a blow dryer on low if they don't want to wait for their hands to warm up the newly applied pouching system. We're going to keep focusing on how to prevent leaks, but we're kind of going to shift over to skincare. And of course, I'm not a WOCN, I'm not a physician, but these are all experiences that I've had and I've learned from my subscribers and my viewers and the people who ask me questions. So, first, it's important to keep the skin clean and dry before applying the wafer, and this means to clean off any excess stool or urine that can be on the skin. Even products can sometimes get in the way of the seal if they're old products that are dried out. So, and it's very important to dry the skin. If there's any moisture underneath, it can cause a yeast infection or it can cause the wafer to not adhere well to the skin. Also, you want to make sure that your patient avoids using lotions or soaps with oils or perfumes underneath the wafer. Some people like to use soap because they feel like they get a lot more clean this way, and that's okay as long as it doesn't have oils or perfumes. When they do have oils, even adhesive removers sometimes can't get all of the oil residue off the skin, and that will make the leak make the adhesive not stick as well. You want to make sure that the excess hair on the abdomen is eliminated. If there are fine, small, short hairs underneath the wafer, then that's usually okay. But if your patient has more coarse, longer hair, it can push up the wafer from the skin and cause a leak. So you want to, of course, make sure that your patient is very, very careful when shaving around the stoma. You don't want to nick it or cause any irritation. So I would suggest using an electric shaver so that you don't get any sort of razor burn or folliculitis around the skin. There's actually this really great tip that I've heard where you put a toilet paper roll that's empty around the stoma in order to protect it from any nicks. It just adds a little extra barrier in between the razor and the stoma. And lastly, apply stoma powder to the parts of the skin that are already broken down. As you can see on the right-hand side, this is my stoma, and this is how I do it. I put the stoma powder all over where the skin and the wafer are, and I brush all of the excess off and just let it stick to the weepy, kind of broken down areas. You can see I had a little leak right around my stoma, so that's where it's sticking. And lastly, I want to talk about some lifestyle ways that you can prevent leaks. So one way is to thicken your output by experimenting with diet solidifying agents or Imodium. And these diet tips can be applesauce, bananas, any sort of bready substance like toast, pretzels, a bagel. Solidifying agents don't actually thicken the stool as it comes out of the stoma, but once the kind of liquidy stool hits the solidifying agent, which is just a little packet you can pop into the pouching system, it turns into a gel-like substance. And then, of course, the physician should absolutely check to make sure that the patient can take Imodium, but Imodium can help slow the digestion process and so really allow the intestines to do their job. Also, make sure that the patient doesn't allow the ostomy pouch to get too overly full. This is called a blowout, where there's no room for the stool or gas to go. So the force of the stool or gas coming out of the stoma actually causes the pouch to lift off of the skin. Now that we've talked about how to prevent or minimize leaks, I want to talk about handling leaks when they happen. And I specifically chose this picture because this is how I want to feel. This is what I want to do when I have a leak. And And so we're not only going to talk about tips of being prepared to handle a leak, but also tips about how to hopefully not let your leak ruin your day, let the leak ruin your patient's day, and talk about the emotional aspects of having a leak. So first, I want to talk about handling leaks and being prepared. So being prepared, I think, is by putting together an ostomy emergency kit. I like to keep one in the car, one in my purse or backpack, and one at work or school. So I would advise your patients to keep emergency kits in the places where they are the most often. So a good emergency kit, to me, looks like this. So a hand or face towel or gauze so that you can clean the skin if there's no paper towels readily available. I don't like using toilet paper because if it's dry, it actually can stick to the stoma and leave a little bit of residual paper on the skin. Also a bottle of water. I like to hike a lot, so I'm not always in places that have water to clean the stool off of my skin if I do have a leak. So just to make sure that water is readily available to clean the skin. Hand sanitizer, because it's really important to make sure that your hands are clean before touching the area around your stoma, and also you want to clean your hands after the fact, after the pouch has been changed. I like to say to keep at least 2 of everything, as many as you think you need in the emergency kit. So keep 2 wafers and 2 pouches, or if you have a one-piece system, of course just 2 of the whole system. This is because we're human beings, we're not perfect. Sometimes we'll accidentally cut the hole a little too large or a little too small, so you always have a backup to make sure that your emergency kit is effective and you actually have all of the supplies you need. And then also just advise your patient to put in everything else that they use every time they change. So this can be stoma paste, rings, or strips, stoma powder. I would highly advise to put adhesive remover or adhesive spray in an ostomy emergency kit. This is important because even though a leak did happen and the seal was compromised, it could have happened on the right side of the wafer, and the left side of the wafer is still sticking really well to the skin. You want to make sure that they don't pull off and irritate the skin and the hair follicles when they do change their pouching system. Also, they can put barrier wipes, safety scissors if they choose not to pre-cut their wafers, a pill holder with all of their just-in-case medications, and I also keep a thin pair of pants, underwear, and a thin shirt in all of my emergency kits. This is because I did have an experience where I had a leak on a plane, and the stool did get on my shirt. So luckily, I had my carry-on full of shirts and underwear and pants so I could change, and there was no big deal. But you want to make sure that if stool or urine does get on the clothing, that they have something to change into. And lastly, I really do want to say that attitude is everything. It's really easy to let a leak ruin the entire day, but it doesn't have to. And we're going to talk about quick pick-me-ups. I also like to call them quick turnarounds. So the day is going in a really negative way after something happens like a leak, and you want to do things that will quickly turn around the day and send you in a good, happy direction. So some of the quick pick-me-ups or quick turnarounds that I've really used a lot is to treat myself to something that I wouldn't usually splurge on. So days that I have a leak, first of course I take care of it. I make sure that I have a new seal, a new pouching system, and everything is cleaned up. And then I'm usually a little bit bummed. So I treat myself to usually a Starbucks. I like their green tea lemonade, and I don't usually splurge on it, so I treat myself in order to put myself in a good mood. I also would like to say just don't dwell on your prior experiences, and I know this is so much easier said than done, but I think that Lao Tzu said it best: if you are depressed, you are living in the past. If you are anxious, you are living in the future. And if you are at peace, you are living in the present. And so living in the present is really important in order to not dwell on the prior experience of having a leak. And one of the best ways to bring yourself to the present is a quick meditation. And if your patient does not know how to meditate, there are actually apps that you can find on a phone, on iPhones or Androids, And the two that are most highly rated and my favorite are Simply Being and the Mindfulness app. And now meditation sounds like it will take a long time, but the shortest session on these apps is 3 minutes. They can do it on their work break. And this just allows them to take deep breaths and clear their mind for a second and then go on about their day. And lastly, self-affirmations. At first, when I heard about self-affirmations, I thought they were a little bit hokey, but after I looked in the mirror, said out loud that I can handle anything that comes my way, and I am strong, I am resilient, I started to believe them. So advise your patient to look themselves in the mirror after a leak and say, there's good in every day, or I can handle anything that comes my way. And after a while, they will believe it. So these are some tips to process your leak and then release it and go on about your day and hopefully still have a beautiful day. Really quickly, before we move on, I do want to talk about how to take care of peristomal skin, or the skin around the stoma. And I know many of you are health professionals, so you probably already know this, but these are some of the experiences that I've had. So the quality of skin, of course, affects the quality of the seal and the wear time. So it's kind of a nasty cycle, because if you have a leak, if I have a leak, then the skin starts to break down. And when the skin breaks down, it's harder to get a good seal. So then it's this nasty cycle of leak, bad skin, leak, bad skin, leak, bad skin. So of course, it's much easier to keep skin healthy than to nurse it back to health. So the best way to avoid the nasty cycle is just to be proactive, to make sure that your patient is in the correct product, to avoid leaks and change the pouching system frequently, which is usually every 3 to 4 days. So another good thing is to keep harsh chemicals away when cleaning skin around the stoma. A lot of people with ostomies like to use baby wipes around their stoma, and this is actually not good for the skin. The best thing to clean the skin is just regular water and a clean cloth. If your client does want to use soap, just make sure, like we talked about earlier, no oils and no perfumes. Next, be gentle. The stoma doesn't have any nerve endings, and also the capillaries are very close to the top or the surface of the stoma. So you don't know if you're being a little bit too aggressive cleaning the skin, and you don't want to cause the stoma to bleed too much. But a little bleeding is normal. That being said, if there's a lot of blood in the output, or if there's a lot of blood from your stoma or from the stoma, make sure to direct them in the surgeon's way or the correct physician's path. So make sure to send them to the correct health professional. And lastly, just follow the correct procedure for having a good seal to lessen the chance of stool or urine leaking onto the skin. That really is the main cause of peristomal skin breakdown, is just stool or urine and the acidity sitting on the skin and breaking it down. I wanted to touch on a couple other daily maintenance tips, and I've chosen 3 common problems that many ostomates have and many complain about. So the first one is pancaking, and this is just when the output gets stuck around the stoma instead of sliding down into the pouch. It can also lead to a blowout because there's this big buildup of stool or urine. Usually, I mean, with a urostomy, you can't have pancaking. It's more common with colostomies, but people with ileostomies can also have pancaking. So the stool builds up, and then it just leads to a blowout. So there's some solutions for pancaking. First, it's usually caused by thicker, stickier stool. So increasing fluid intake is an easy way to thin out the stool a little bit in order for it to slide down into the bag instead of pancaking around the stoma. You can also suggest using lubricating deodorant or olive oil. A lot of people use olive oil, and at first when I heard this tip, it made me nervous putting olive oil in my pouch. But then my surgeon told me, you ingest olive oil. It goes through your intestines anyways, so it's okay if it touches your stoma. And that really brought it home, that it's okay to put things in your pouch that you ingest. And next, add fiber to the diet. That can really help with pancaking as well. And lastly, one of the theories of why pancaking happens is because the pouch actually turns into a vacuum because the filter works so well that there's no air in the pouch. So there's nowhere for the stool to go and fall down into. So blowing air into the pouch before applying it, or putting a square of toilet paper down in the bottom and crumpling it up, just to keep the sides of the pouch from sticking together, can actually allow the stool room to slide down into the bottom of the pouching system. Next, I would like to talk about ballooning, and this is when the ostomy bag inflates with gas, and this can also lead to a blowout if the pouch is so full of gas that there's no room for anything to go, and the stoma outputs again, it can pop the pouch right off of the skin. So some possible solutions are to try a product with a filter. If your patient is not using a pouch with a filter, this may help a lot. Also, if your patient has a two-piece system, then they can actually pull away the pouch from the wafer and what we call burp the two-piece, which is just letting the gas out. Also, advising your patient to eat regularly without skipping meals. This can actually produce a lot more gas in the body when you skip meals. And then tell them to avoid chewing gum or drinking through a straw. This also has them ingest more gas, which leads to more gas in the pouching system. And then also try to keep the stool away from the filter. When stool hits the filter, it can clog, and so the filter becomes irrelevant and it does not work. Also, talk to the primary physician about seeing if the patient can use Gas X or something along those lines to keep gas at bay. And so the main concern with ballooning for ostomates right after having a blowout and a leak is how to conceal ballooning. And so here are a couple tips that are just really easy things to do to conceal ballooning. So of course, dark clothing and patterns allow the eye to not really focus on any bulges. High-waisted pants or shorts or skirts draw the eye up to the waist above where the pouch is. Loose t-shirts hang away from the abdomen, so it just gives a little bit more room for the pouch to expand. Pleated trousers also give the pouch more room to expand. Bringing a light jacket or a loose sweatshirt is really a great way to conceal ballooning if the patient can't get to the restroom right away. Just popping on a light jacket allows it to hang away from the abdomen, and it really conceals and you can't tell that anything is there. Also, this isn't really a clothing tip, but turning the ostomy at a 45-degree angle away from the middle of the body allows the pouch to fill, and it actually just looks like something's in your right pocket or your left pocket if the ostomy is turned at a 45-degree angle. And then clothing with a cinched waist, kind of like high-waisted pants, it just draws the eye up above where the ostomy pouch is. But really, I think what's more important for concealing an ostomy that's ballooning is what's underneath. And these products will help keep the ostomy bag close to the abdomen so that when it fills up, it's a little bit more easily concealed. So I wear Spanx every day. I would not suggest Spanx for someone who newly had surgery or if their abdomen is still tender. Since they are tight, it can cause a little bit of pain if the abdomen is tender at all. If it is tender and your client doesn't want to wear Spanx, they can get a belly band. For a lot of pregnant ladies use belly bands, or a bandeau, which is kind of like a tube top, but it's made out of a nice stretchy cloth material, and they can put that right over their pouch. Also, there are specially made ostomy wraps and stealth belts. You can put that into any search engine online, and it will come up with a bunch of results, and they can purchase those, and those are specially made for ostomies. Also, spandex biker shorts. This just once again keeps the ostomy close to the skin, and high-waisted underwear also just adds a little bit more security and a little bit more, it makes it a little bit easier to conceal. The last daily maintenance tip I want to talk about is odor. And this is, of course, when you're able to smell a strong scent coming from the pouching system, either while it's still closed or while emptying the contents. And the first thing I want to focus on is that if the pouching system is still closed and there's an odor coming from the pouching system, check for a leak. That could be the first sign of a leak, so make sure that there's no stool coming out from underneath. And also check the filter. Sometimes if the filter becomes really, really clogged, it can let out a little bit of smell, but this is usually after the product has been used for many, many days. This has only happened to me when I used a pouching system for 8 days. And of course, I did have a leak and the filter was clogged. So also suggest using deodorizing products like a deodorizing drop or spray. A lot of ostomates actually put mint Tic Tacs in the bottom of their pouch, and when they empty the contents, it smells kind of minty instead of like output. And lastly, implementing some dietary changes will definitely help odor as well. We're going to talk about diet next, but for example, with odor, fish and eggs definitely makes a more prevalent smell coming from the pouching system and the output. So before we get into odor and all of the different solutions for different problems that can be implemented with diet, I want to go over some general tips about how to reintroduce foods into the diet. So this sounds like a very tedious process, but it is one of the only ways to make sure that you know and the patient knows which foods affect them in a positive way and which foods affect them in a negative way. So add 1 new food a day. So if you try 3 new foods a day and you have a bad reaction, you don't know which of those foods caused the bad reaction. Be patient and follow the process. So my process, and now I've had my ostomy for almost 4 years, so now my diet is very large. But right out of surgery, I only ate a couple things and added 1 new food a day. I took a couple bites, chewed very well, followed it up with a bunch of water, and waited a couple hours. If I felt like food passed and I didn't have any problems, I would take a couple more bites, chew very well, and follow it up with more water. After a whole day of doing this process and you think the food does not bother the patient or does not bother you, then that food is probably okay, and the next day you can follow the process with a different food. It's also important to try 5 small meals a day instead of 3 large meals a day. So 5 small meals a day just allows your body to process it and keep food more consistently in your system. It also, of course, like we talked about, helps eliminate gas. It's also important for people with ostomies to drink a minimum of 8 glasses of water a day, or other fluid. But coffee and tea does not count. Caffeine is actually a diuretic, which means that it causes you to urinate. So you can lose fluid if you drink coffee or caffeinated tea. So make sure that the person is drinking 8 glasses of water or other fluid a day, coconut water or some sort of juice. That's what they're doing. Be careful and chew thoroughly when eating fibrous foods like vegetables. But everyone is different. I have a friend who's vegan and has an ostomy, but I cannot tolerate most vegetables and fruits. So finding the right foods that work for your patient or work for you are very important to maintaining a healthy lifestyle with an ostomy. And also it's important to make sure that if a person cannot tolerate many fruits or vegetables, that they ask a doctor or dietitian about a multivitamin that gets absorbed in the right part of the GI tract. And also, you can suggest making smoothies or drinking juices made of fruits and vegetables. This is not a complete list of a dietary or nutritional problems and ways to prevent these problems, but this is just a good overview of what causes gas and what can cause odor and how to prevent them. So, foods and beverages that cause gas can be things like beans, cabbage, broccoli, those kinds of things. And then preventing gas is as simple as cooking the vegetables to prevent gas. Don't drink through a straw and eat more frequently. Also, ask the physician about prescribing the patient Gas X. It is over the counter, but you want to make sure that it is approved by the physician. Foods that cause odor, things like eggs, fish, like we were talking about, and unfortunately, alcohol. Now, this doesn't mean that you have to cut out eggs or fish or beans or broccoli completely. It just means that maybe balance out. So if you have eggs or fish, then use some foods or beverages that prevent odor, like cranberry juice or yogurt or kefir. Also, possibly use some odor eliminating drops or a Tic Tac at the bottom of your pouch. Foods that cause blockages and constipation are fruits and vegetables with skins. Also celery, corn, and mushrooms I've heard are absolutely terrible for causing constipation. So preventing blockages is just chewing very well, drinking plenty of water, and drinking grape juice. There are foods that can cause diarrhea or thin the stool, and these are things like beans, beer, broccoli, chocolate, wine, all the really great things. So foods that thicken stool are things like applesauce, bananas, pasta, and white rice. So if you have some beer or some chocolate or red wine, then maybe just think about following it up with some applesauce or bananas or pasta. And lastly, people with ileostomies are at higher risk of developing kidney stones. So foods that may contribute to kidney stones are foods that contain oxalates. You don't have to cut these out altogether, but they're chocolate, green leafy vegetables, instant coffee, nuts, and seeds. And preventing kidney stones is eating foods rich in calcium, drinking milk, eating yogurt, and also, of course, lots and lots of water. So next, I just really quickly want to read some very common questions that I get from Ostomates. And one of them we've already kind of talked about, the how to prevent gas. So of course, gas X if the physician says it's okay. Don't drink out of a straw, but also walk. Walking helps move gas and stool through the system. So if they are experiencing gas pains, then walking is a great way. It's the last thing that you want to do when you're in pain, but it helps move the gas along and eliminate it from the body. Can I use my diet to help other issues I have? Absolutely. Not only can it help things like gas and odor, but it can also improve issues like inflammation and nausea. Of course, nausea, mints and ginger ale help. And for inflammation, they can try green tea or turmeric root or resveratrol, which is found in red wine. But for patients under 21, of course, there is a supplement that they can use. And how do I know I'm getting the correct nutrition? And my biggest tip for this is to keep a food journal and show it to the doctor or registered dietitian during their next appointment. But I do want to make sure that people are educated about the physical symptoms of malnutrition, like lack of energy, irritability, and having a hard time concentrating. Because if they are experiencing these symptoms, then it's important that they make an appointment right away and don't wait until their next doctor's appointment. So that concludes my prepared portion of the webinar. I really quickly want to point out the sites and contact info at the bottom. You can visit the site at shieldhealthcare.com/community/ostomylifestyle, and this is where this webinar and last webinars will be up to listen to at a later date. You can contact me at asklaura@shieldhealthcare.com, and also we have a new OstomyLife Shield Healthcare community, and we have a Facebook page, which is just facebook.com/ostomylife, and a Twitter page, which is just twitter.com/ostomylife. So thank you for tuning in, and now I will open it up to any questions. You can just type it in the box, and Eric will read them to me, and they don't have to be questions about the information that we talked about today. I'm willing to answer any questions that you have. So thank you very much.
Great. Thank you, Laura. Yes, if you have a question, please type it on the chat box on the lower right-hand corner. We have a question here from Joyce. How often do you personally change your wafer?
So I wear the extended wear barrier, so I actually can go about 5 to 6 to sometimes 7 days. That's not usually recommended, but it's just what works for me. I take off my wafer and there's no skin irritation, there's no yeast infection. So I usually go 5 to 7 days, but it is recommended at the beginning that someone change it every 3 to 4 days.
Great. Question from Brett. How do you fix a leak at a wedding when in dress clothes?
That is a great question. Well, it is kind of the same everywhere, no matter what clothes you have. It's just to go into the restroom, clean yourself off, change your pouching system, and if it did get on your clothes and you don't have any extra clothes, I would suggest running back to the hotel, changing, and coming back. But that is a great question because absolutely, no matter where you're at, you want to make sure you have at least 2 pairs of clothing that can work for your particular situation. So maybe pack an extra pair of dress clothes when you're there.
Great, thank you. Question here from Daniel. Does the wafer's adhesive expire somehow?
Not that I know of. If it's very old, I would definitely call the manufacturer and ask. But one thing I do want to say is sometimes if you leave your pouches or your products in a hot car, they can actually melt. So if you have an emergency system that's in the trunk of your car and it's 80 or 90 degrees, I would run out to your car, grab them, and bring them into an air-conditioned area so that the adhesive and the plastic do not melt.
Great, thank you. I'm leaning over here.
No, that's okay.
People can't hear me. So will the slides, handouts be available after the webinar? All this information is on the community site, www.shieldhealthcare.com/community/OstomyLifestyle. Again, this webinar is recorded, so if you missed any of this, you can go onto the community site and listen to the webinar again. However, the slides will not be available, but the information will be on Laura's blog. Another question here from Christina. You talked about Spanx. Do Spanx interfere with output from the stoma?
I don't find that they do, but I do find if someone has a diverting ileostomy where there are 2 holes, sometimes if I have a lot of stools and a lot of gas in my pouch, that it actually can go back into my intestine and it will then come out of my rectum. So sometimes I do get stool that exits out through my rectum because I wear Spanx. So you can tell that this is happening because you may feel a little bit of pressure, and if that person is uncomfortable with it, then absolutely tell them don't use Spanx anymore. But I find that it doesn't interfere with stool or gas coming out into the pouch. It's only when it's all full or ballooned that I do experience that kind of backwash.
Great. Do you recommend wearing a belt?
I think that it really depends on your comfort level. You don't have to wear a belt, but if you want an extra layer of security, if you want to make sure that your ostomy is close to your skin and pulled into it, then you can absolutely wear a belt, but it is all comfort level of the individual.
Okay, great question from Natalie. What was the hardest thing for you to get used to after surgery?
That is a great question, and I would say actually telling people about my ostomy was the hardest thing for me. My diet changed a lot because I have a lot of adhesion. I can't tolerate any vegetables or fruits with skin. So people would always ask me, why can't you eat this? Why can't you eat that? Are you allergic to 100 things? And so I had a difficult time educating them about my ostomy, and that was probably the hardest thing for me to get used to.
Great. And there's some positive comments here. You are a great resource for ostomates. Thank you for what you do. From Cheryl. Stephanie asked, does the ostomy powder somehow hinder the adhesion of the wafer?
That's a great question, and that's why we make sure that we brush off any of the excess powder on the skin, because if there's a lot of powder on the skin, yes, it can interfere with the seal, but also it helps the weepy areas of the skin. The powder sticks to that, and it actually helps the wafer stick to the weepy areas. So make sure to brush off any of the excess powder that's on the healthy skin and only allow it to stick to the broken down parts of the skin.
Great. Can we view the food slides again? Can you back up to
Absolutely.
And then while we take more questions, we can just leave it on there.
Yeah, absolutely.
So many questions here. What is the YouTube channel again?
So the YouTube channel, you will just type into the top search bar Shield HealthCare, and Shield HealthCare will have a whole link to just the ostomy YouTube. And we have about 5 or 6 videos up about ostomies.
Great. what do you do when the ostomy makes sounds?
That's a good question. Well, there's not a lot that you can actually do, but when I start to feel pressure, because I actually feel pressure, or when you start hearing sounds, I would just suggest putting your hand and pressing gently over the stoma, and that will actually muffle the sound. And if it does still make a lot of noise, then I just kind of joke with whoever I'm around that, oh, I'm hungry, because it doesn't really always sound like gas passing. It sometimes just sounds like a stomach rumbling.
Great. Couple more questions here for you. If wearing tight clothes, does it increase the risk of having a leak?
I have not personally found that. I have actually found the opposite because it keeps everything kind of tight and close in. So, but once again, you want to make sure that if you're wearing tight clothes, not to let the pouch to get overly full, because then it's kind of getting pressure from the inside and from the outside with the tight clothes. So you want to make sure that you keep your pouching system pretty about 1/3 to a half full, and then it's time to empty with tight clothes.
Great. I think we have time for one more question. What would you say to somebody who's afraid to get an ostomy?
Well, I would say that it is a life-saving procedure and that having a bag is better than being in a box. That's something that really hit hard when my doctor told me it was either a bag or a box. And I would say that life can continue to be beautiful. You can do everything, most everything that you do without a stoma, if not more. I have gone backpacking in the Canadian Rockies. I have run a half marathon, and I have gotten into a relationship. There are so many things that you can do with your ostomy, and really the only way that it affects your life is the ways that you let it affect your life.
Great. Love that. On that note, I'd like to thank Laura Cox for her presentation. That was great. If you do have any other questions, please go on and ask Laura at shieldhealthcare.com, and we can answer your questions there. And again, this webinar is being recorded, so if you miss anything, please go on our community site to check that out. And lastly, your feedback is important to us. So when we end this webinar, you should get a pop-up with some questions. Again, your feedback is important. If you have any ideas for other webinars, please let us know. In the meantime, again, check out our community. We have great information on ostomy, and Laura posts her blog once a month on there. And then, yeah, if you have any other questions for Laura, please contact her at asklaura@shieldhealthcare.com. Again, I'd like to thank Laura for her great presentation. Any final thoughts or?
No, just please join our Facebook community. We're really trying to start that out, and we can be in contact on there. We would love to hear about your story, answer any questions that you have, and share my story and my experiences with you. We really want this to be a community where ostomates can connect to one another. So the Facebook page is facebook.com/OstomyLife. And thank you so much for tuning in. I hope this was helpful, and please email me with any questions that you may have.
Great. Thank you, everyone. Have a great morning.
Thank you.